I'm Rick Kaler. Thanks for joining me. Last week's column concluded that while long-term care insurance is unaffordable for most Americans, everyone needs a long-term health care plan. Knowing how long you're going to live, well, that's one of the first variables to consider in putting together such a plan. A number of online sites can give you a scientific estimate of your life expectancy. One of the sites that I recommend that I've used for years is called living to100.com. It's kind of all one word, living to100.com. I recently retook the evaluation and I was surprised. My life expectancy had increased from 98 years of age to 100 since 2016. I was kind of pleased with that. Two major issues to consider in creating your own long-term care plan are where you will live and how you will pay for the care you're likely to need. In part because of cost, most seniors want to stay in their own home. So in order to make this more likely, it's important to consider some things in advance, like the following. Number one, what's the proximity of your home or where you live, say to grocery stores, medical facilities, other needed services? Then consider the accessibility of your home. That means, can you live on one level? Multi-storied levels can cause a real problem. Split level homes, even 6 stairs, can be incredibly problematic. Can you remodel for handicap access? Accommodate ramps, have space available for people who may want to live in that can take care of you. The third thing to consider is a plan for home maintenance. How are you going to care for the home? How are you going to pay bills? Who's going to do the shopping? How about the transportation? Now, there's a lot of services available for this. Transportation, we're fortunately in the age of Uber and Lyft, but these things need to be thought through. Next, the availability and estimated cost of in-home support medical services is important. And probably more important, how's your willingness to use them? They're available for enough money, you can afford them, but will you use them? And I find actually more resistance amongst people to actually using them. It kind of gets into the fear and taboo of asking for help and what that means. The fifth one is access to an emotional or social support system of friends and family. Social interaction is really important. So even with a goal of staying in your home, your plan needs to consider how to determine if and when that is no longer possible. We use a evaluation called Journey into Elder Care. I'm sure there are many out there on the internet. So doing this, I mean, this time when you need to consider is it time, might be when friends or family feel it's a safety issue for you, or when you can no longer perform certain functions. It's best if you inventory your ability in many different areas, say on a 1 to 10 every year, every 2 years, every 3 years. The second large concern, of course, is how to pay for long-term health care. Costs not covered by Medicare that we pay for out of pocket include nursing facilities, followed by assisted living facilities, independent living apartments, adult daycare, and in-home care. This is where the long-term care insurance can come in handy. Except it's unaffordable for most. And it often doesn't cover all the costs. Like my policy only covers 50% of in-home health care. And the other problem with the long-term care insurance is insurance companies routinely try to deny claims. Obviously, with most people not being able to afford paid long-term care, most long-term health care is unpaid. According to AARP, in 2017, over 41 million family caregivers in the U.S. provided an estimated 34 billion hours of care to an adult with limitations on their daily activities. The estimated economic value of their unpaid contributions came to $470 billion. Studies show that unpaid caregivers, which are typically family members, provide an estimated 80% of care to individuals still living at home. The average caregiver spends 16 to 24 hours a week, and most of them are 50 to 64 years old. The worth of their time averages about $30 an hour, and they will serve as caregivers for an average of 4 years. This was once a statistic to me, but it's become very real. My wife is the medical advocate for all 4 of our aging parents. The time requirement of daily phone calls, online research, attending medical appointments, coordinating between health and care workers, helping to run errands is easily 24 hours a week, or more some weeks. Based on my research, the cost to caregivers in lost wages, benefits, and out-of-pocket expenses ranges from a low of $150,000 to $750,000. And studies show the average is around $300,000. The more retirement savings you have, the more you can avoid placing this burden on your family members. If you are approaching retirement without adequate income, you might want to consider working longer and reducing spending now in order to provide for your long-term needs. To increase your options for living in comfort and dignity as you age, it helps to create your own long-term health care plan before you need it. Thanks for listening.